So, welcome everyone to the Community Pharmacy More Profit Roundtable. This is the mini version. We do an hour-long podcast once a month, which happens to fall on the second Wednesday of each month. But then we do this mini roundtable once a week to help community pharmacies learn about some of the amazing clinical services that can help bring more profit to their pharmacy. So, my name's Breck Rice. I'll be your host this afternoon, along with the Vice President of Sales and Marketing from Seniors Home Services, George Veronis. I've been a community pharmacy advocate for more than 20 years, and I host the PBM Reform podcast on the Pharmacy Podcast Network. I'm also the co-founder of ServeRx. ServeRx is a third-party revenue cycle management service for community pharmacies, and I am partnered with every PSAO in the country to be their value-added service to help pharmacies get the fair reimbursements they deserve. So everything that I do with my own company, with the podcast, it's all talking about how to bypass the PBMs for more profit for your pharmacy. And so even though we're making some positive changes on PBM reform, it's a really slow process. It's kind of like a little guy in a rowboat out there chiseling away at the iceberg so that the Titanic doesn't run into it. Well, he may be making progress, but it's sure a lot slower progress than it needs to be. And if we could bypass the iceberg entirely, that would be a much better solution. And so that's what my other podcast series is all about, the Community Pharmacy More Profit Roundtable. And that is our title sponsor, RX One Shop, that does the shopping to find the good deals to help community pharmacies save. Remote therapeutic monitoring is step one in a 3 steps to success with providing clinical services at your community pharmacy. I've always been a big advocate that pharmacies need to bring in at least a third of their revenue through other channels. You can't just depend on just dispensing medication any longer. The PBMs just don't pay you enough on just focusing on dispensing. And so clinical services is the next frontier for community pharmacies. And it starts with remote therapeutic monitoring. Like I mentioned, there's no cost to the pharmacy, doesn't take any extra staff to do this program, and it will bring pure profit to your pharmacy. Step 2 is not required, but if you are interested, it's a way to expand your scope of services into additional medical billing solutions. I'll touch on that a little later in the program. And then step 3 is a full brick and mortar clinic that is owned by the pharmacy, but is managed and staffed for you. So that is another program. Again, you can do step 1 completely independent, never take step 2 and step 3. You just can't do step 3 without step 2. Step 2 is a prerequisite for doing the full HIPAA compliant clinical room. Now, what I wanted to just touch on real quick, because this is a whole separate demo if you are interested in learning more about the fastest growing community health collaboration in the country, which is the Independent Pharmacy Provider Network. This is now taking step 2, or really expanding your scope of services in helping patients in a better way to have better outcomes. And this is filling care gaps in health today. So it's a win-win-win. The patient wins because they have easier, more convenient access to care by going into a community pharmacy rather than waiting around for a week or a month to get in to see their primary care provider. The primary care provider wins because he's still managing the care plan of the patient and he's getting compensated for that. He's improving his quality scores so he can get higher reimbursements as well. And now that patient isn't taking up a tremendously valuable spot in his already too full calendar, right? But the pharmacy always wins the biggest in this program because on average, 67% of all the bill charges stay with your pharmacy. That is very important to understand because a lot of our clinical pharmacists that have gotten involved in CPAs and doing collaborations with providers in the past didn't make out all that well. The physician took all of the profit. They wanted 80% of the profits, and pharmacies were having a hard time making ends meet with those clinical collaborations in the past. This flips that model on its head, and the pharmacy is controlling the bill charges that are coming through. And again, on average, 67%. So this turns a flu vaccine that you're only getting reimbursed, $17 to $20 into an $85 preventative health visit. Or all of our community pharmacies today are giving away their time and services as, just out of the goodness of their heart to help patients set up their glucose monitors and show them how to get their data from the monitor. Well, once you're in network, you get compensated for that, anywhere between $50 to $150 per month on the for as many patients that you have on those glucose monitors. So an amazing program that, again, is a separate demo, but if you have interest, we'll make sure that you get in contact with the Independent Pharmacy Provider Network. By the way, they already have over 4,000 physicians who are a part of the network. And then they're recruiting your local physicians as well to collaborate with you. The last point that I want to make is the full brick and mortar clinic. This won't be a solution for every pharmacy. You've got to have a footprint area of anywhere between, somewhere around 10 to 12 square feet to put up the walls and the door to make it HIPAA compliant, and also bring in plumbing for the hand washing station that will be required for the clinic. But this three-legged stool here, the first leg is the managed services. It's the build out of your clinic. It's the management of that clinic. The second leg of the stool is pretty interesting concept here. It's the talent exchange. Imagine Uber or Lyft, those rideshare programs, but this is like Uber for medical staff. So instead of having an expensive nurse or nurse practitioner on staff, you only bring them in when you need them. So you post a shift, a nurse fills the shift. It's a pretty unique concept. And then the third leg of the stool is what I'm actually the most excited about, because that is the financial vehicle. Not only will the pharmacy fund help you set up your clinic, but when you pay back the fund, you become a cooperative member of the fund. So now you're helping the next community pharmacy set up their clinic and now earning interest in the fund. And that interest just continues to grow and grow. So it could be a part of your future retirement when you're ready to hand your pharmacy down to the next generation of pharmacists. So that's our program today, what we wanted to share with you. Exciting times for community pharmacy. We've had a lot of bleak years and we've seen a lot of pharmacy closures. And I think these programs will really help you bring the added profitability to your pharmacy that's needed in order to be successful and help your patients in a way you've never been able to help them before. So thank you, George. Appreciate all the information you shared with us today. I thank all of our community pharmacy owners that joined this session this afternoon. We're here to help you any way we can. And this has been the program for today. So thank you for attending.